ABC 10 News starts now.
All right, up next, we're going to tell you about an alarming study about smoking e-cigarettes. Tonight, why local researchers say they're more dangerous than cigarettes. The local doctor behind the study will join us live to break it all down. E-cigarettes and vaping continue to gain popularity, but tonight a new study is out that shows e-cigarettes can cause more damage to your lungs than regular cigarettes. One of the local doctors behind the study works at the University of Pennsylvania. So joining us now is Dr. Jacob Dubroff. Thank you so much for your time, Dr. Dubroff.
Great to be here. Thanks for having me.
Of course, of course. First off, were you surprised by the results?
Absolutely. So we know of decades of following smoking behavior in traditional combustible cigarettes that it's terrible for your health. Cancer, heart disease, stroke, all consequences of smoking for a long time. In our study using nuclear medicine PET techniques, we could look for inflammation. So we don't know, harm is tough to measure, but we think we see more inflammation with the electronic cigarettes, the vaping behavior, than we do with regular cigarettes. And that's what's alarming from our study here.
Sure. You mentioned nuclear medicine. For those at home that aren't familiar with the term, could you describe it in layman's terms?
Yeah, sure. We use a very specialized radioactive tracers or drugs that we administer to patients, and we use specialized cameras to kind of take pictures of where the radiation can go in the body. It's very low amounts, so it's very safe for patients. So if you've ever heard of someone having a PET scan or a stress test, nuclear stress test, these are examples of nuclear medicine techniques that get used all the time. The technique we use in the paper is not one that your normal doctor would just prescribe. It's one that we use for specialized research because we have a wonderful facility at the University of Pennsylvania.
That's great. And the study found vaping causes unique inflammation of the lungs. I saw that. It's important that young people have this perspective too. You know, correct me if I'm wrong, damage to the lungs, like scarring, for instance, is generally irreversible, right?
Yes. Once you have a condition like emphysema, which takes a long time to develop from, say, smoking or other types of lung disease, lung exposures, you kind of just try to use the lung as best you can, but you can't make it like it was 20 years earlier, like a younger person's health. So you can't wind back the clock on many types of lung disease, especially those that are associated with smoking.
It's good perspective for kids particularly, right, as they make these decisions that could affect them farther down the road. What do we do with this info? Yeah, go for it.
But one of the things that really motivated us to do the study is the alarming rates of the electronic cigarettes in youth, because we don't know what it's going to mean 20 years from now. And actually, the U.S. Food and Drug Administration had a survey from last year which showed that almost 16% of high school students use, and the majority are vaping. And the ones who vape, a quarter of them vape every single day, and 40% of them vape 20 times out of 30 in a month. So the vaping behavior is not cooling, is not stopping. It's really, it could be building speed, which is very alarming to us.
Absolutely. Do the results of this study, does it help you better identify disease? Does it help in the treatment at all?
Well, so I think what's great about a scientific study, it asks more questions using, and we think using this technique, this nuclear medicine PET technique, is going to really be able to open up new pathways to look at disease and follow patients and follow treatments. But I think we just have to really define better what's going on, because it's still very early on in the pattern of using these electronic cigarettes and vaping. They're a relatively new behavior for nicotine.
Yeah, a lot of good things to know there for high school students, maybe younger, for parents certainly. Dr. Jacob Dubroff, thank you so much for your time.
Great being here. Thanks for having me.
Of course, of course.